Before we get started, here's the agenda. We have some remarks. I'm going to go through some housekeeping rules. I'm going to introduce some of the VIPs, elected officials, and folks from Fort Riley, the leadership there. We have a transition of our executive committee chairs from Rich Jankovich to Leslie Alford. We're going to do that. Then I'll present our guest speaker, Colonel Ann Kang, and she will give her presentation. Then we'll do the Briggs drawing. And of course, if there's any Q&A, we'll entertain the questions. And then we will be done.
You want to talk about how to do questions?
Yeah, I will. So first of all, I'd like to thank our sponsor, Briggs Auto. At the end of the call, we will have a drawing for today's prize, the famous Briggs Taser. So I hope you all are excited with that, and we will figure out how to get that to you with Dick Young soon. Come through me. And then here's just a couple of housekeeping rules. I know all of us are probably pretty good at this these days, but just in case, please be sure to keep your device muted so that way we don't have any feedback. Please don't talk over anyone else. If you have questions, I'm going to ask that you please use the chat, and then we will answer the questions after Colonel Kang's presentation. And if at any time you need to leave the meeting, just go ahead and do so. There's no issues at all with that. So for right now, let's thank our local officials. Well, I had the screen is not here. So hold on a minute. There we go.
Share the screen.
Yeah, it's hold on. Share. Excuse. Is it sharing?
Can you all see the?
Can you see a blue screen right now, or is it the chat?
I'm seeing shaking heads now.
Okay, hold on. Hold on. Okay, and hold on a moment, please. Okay, so there we go. Whew. So here, we have a lot of distinguished people on this call today. I've listed them on the screen, and I want to thank all of them for participating today. If we were in person, I would announce them all and we could all applaud them. And I would like to applaud them for coming on board today and coming to our MRC lunch. So, and so now I'd like to introduce our outgoing and incoming chairs for the MRC Executive Committee. Over the past few years, I've been really lucky to have Rich Jankovich as our Executive Committee Chair. He has been extremely involved in the MRC and with Fort Riley for the past few years. He got involved with Fort Riley back when he was the City Commissioner a few years back. And I've really leaned on Rich a lot for a lot of different things, and it's been such a pleasure to have him on board with us. So he has a little bit of a presentation on his way out, and then I have a little bit of a presentation, and then I'll introduce Leslie, and then we'll introduce Colonel Kang. So let me get the screen up for Rich real quick. All right, Rich.
All right. So, Janet, if you can do the slides for me, that would be great. So the past 4 years have been really quite a ride. So next slide. I started, at the end of my first 2 years, I did a presentation called Why. So I'm starting where I finished, and I will finish where I started. So you're going to have to stay on here to see how that works. So when I presented the Why, I finished with a slide of a local Manhattan Fire Department fireman and being treated by a local Riley County EMS paramedic. that just happened to be my son and my daughter. And quite frankly, I still get emotional when I see the picture, and I think of the circumstances and think of the two of them. But it did tie back to Major General Pat Frank's promotion to Brigadier General, and him talking about his brother flying him into combat, and that's my presentation 2 years ago. So for this and my two kids there, no mission too difficult. Next slide, please. And now I'm frozen up. So now you see a picture that was in the last one, so tying back real quickly to my family history. It's my great uncle on the left and my grandfather on the right, staying in front of their T6 Texan during World War II. Next slide. The next one, which I didn't have and I finally dug out, is a picture of my uncle, my youngest uncle, Bill on the left, my father in the middle, and my Uncle Bob, the oldest, on the right. And I did talk a little bit more about my Uncle Bob in that one in the Y presentation, but I thought you might like to see their pictures in the Army. Hold on just a second. My youngest Uncle Bill and my father were both drafted, and Uncle Bob was an Air Force ROTC cadet, became a SAC pilot. My dad was in an aircraft battery in New York Harbor, and my Uncle Bill found a way to hide in Panama as a clerk. Next slide, please. So this is just a quick photo of my uncle and his air crew in front of his B-52. I'm thinking somewhere around 1965 because of the Hound Dog missile there. But he flew over 200 combat missions in 52s and 100 combat missions or so in EC-47s in Vietnam. And I've got a lot of material, so our Air Force ROTC guys, if you'd like to check any of that out, feel free to give me a call. Next slide, please. So over the past 4 years as chair of military relations, had the honor of meeting, and this is just freaks me out when I think about it, 2 chairmen of the Joint Chiefs, 2 secretaries of the Army, 1 SecDef, welcomed 4 commanding generals, command sergeant majors, 4 garrison commanders and command sergeant majors, as many IAC and DENTAC commanders and CSMs, division chaplains, their staffs, brigade, battalion commanders, CSMs, soldiers' spouses, and their families, and it's way too many to name them all. But from Tim Livesey, Bill Turner, John Lawrence, Bill Clark, Kurt Cornelison, Joe Warrow, Wiley Hutchinson, Steve Helton, Steve Schrader, Jason Smith, Sam Baker, Jim Champagne, Dick Young, and so many others. I personally want to thank you for letting me a part of your time in our community and allowing me to ask all the dumb questions that I could possibly think of through the years. I'm truly honored to be in your company and humbled by your service. I'm avoiding naming everyone, and I'm representing everyone by those that I did name, because I can't name them all in a short time. But to suffice it to say, each of you has a special place in my life, and thanks are never enough, but thank you. You've always allowed me to look into the window of the Army, the division, garrison, and all the commands within, and always made me feel welcome, as I sincerely hoped I did to each of you. Next slide, please. One thing that I wanted to highlight that's actually outside of my time with the MRC and actually with as chair, you're seeing 3 photos of a young man by the name of Ian Field. One of the most touching and inspirational events that I ever witnessed at Fort Riley in the past 17 years was in April of 2011, a young boy, 7-year-old Ian Field, was granted his Make-A-Wish wish to become a U.S. Army soldier. He was assigned to the 4th Brigade Dragons and welcomed into the 1st Battalion, 28th Infantry Regiment, the Black Lion Battalion, as an honorary CSM, and was given his wish to become a soldier. Had the honor to meet and speak to Ian and his family at the change of command from Colonel Warrow to Colonel Manalga. The Dragons were the first team to welcome me into the Army family in 2011, so it was even more special for me. Colonel retired Joe Warrow and his CSM retired Wiley Hutchison were tops and continue to correspond with me today, as many others are. But I really wanted to highlight this event because to me this shows the compassion, the heart, and the character of the entire division and all the related commands. There was nothing more touching that I've ever witnessed. Next slide, please. So I want to highlight some heroes real quickly. The past year has been one that we can't even count for the record books. It's been crazy. We as a community and a people have not seen anything quite like this, even more so since 1917, 1918. So I picked a few to represent our best. And I'm not trying to leave anybody out. I just want to highlight a couple. I have a coworker by the name of Bridget Hoover. She's a quilter. When the pandemic hit, she started cranking out masks without anyone asking to do her part. She donated them to anyone and everyone that asked within Purple Wave, as well as anyone in our communities. I don't know the total number of masks that she did, but it was in the several hundreds, and is still doing them today to try and help out. Christine Benny, who was building our AUSA chapter for the last several years and fighting for veterans and military family rights. I don't think you could find a better example of a hero. Crystal Bryant Kearns, making the Fort Riley USO Pathfinders the premier organization, assisting transitioning soldiers to civilian careers and advocating for the Flint Hills regions. And I'm proud to say that myself and one of my coworkers, Jeff Denny, are volunteers to help with those mock interviews and assist the transitioning troops when they come. How about our essential workers? Look around, they're everywhere, from the grocery store clerks to the convenience stores, our entire region's medical professionals, first responders, the Irwin team pivoting, maneuvering, developing protocols, teachers learning to instruct in different ways to give the best possible education when normal was not allowed. I would be remiss to not acknowledge my family, Nick, Jillian, and Will, who are still protecting Manhattan and Riley County. And Caitlin, next slide, please. Oops, I'm a little ahead of myself. So real quick, these are the Manhattanites that I wanted to honor that have been honored by the division and the Army. You can just see those quickly, and we'll share this later. Next slide. I'm still ahead. So anyway, my daughter Caitlin is in Indianapolis, but I want her to be the representative for our local realtor teams. Even though in Indianapolis, she found ways that I know everyone here did to stay safe and keep their clients safe with their life changes happening with home purchases. Our small businesses are the heart and soul of our business community within the region and trying to stay alive. Restaurants pivoting to support their teams when it seemed all but impossible. And look around, I have no doubt that we can see even more. The military families and their resilience always continues to amaze me. So please, common kindness is a wonderful thing. And don't forget to thank those that put themselves out there to help maintain some sense of normalcy. Thanks, sorry, little tongue-tied there. The recognition we just did, the appreciation that I have for those that have been a part of my time as the chair and also with military relations. I have to start with the division protocol teams, garrison, hospital, and the division teams. But first, I have to say a very special belated happy birthday to my friend Tony Pablo, whose birthday was a couple days ago. But these guys are the unsung heroes of the First ID team. I want to personally thank you for your patience, your dedication, and willingness to find unique and creative ways to keep everyone engaged and always making us feel welcome when we came to visit. My MRC team. I'm truly humbled to have been your chair for the past 4 years. The work we've done together to make Manhattan that much more special and a welcoming place for our Fort Riley neighbors. It's truly inspiring, and I'm honored to be a part of this team. Little Apple Brigade. I've learned that our events are a huge highlight for our Fort Riley friends, and it's passed from command to command. Our dedication to the division and all of Fort Riley is greatly anticipated every year with each new command as they come on post. Even with the pandemic, we found a way to say welcome, thank you, and we are here for you, our Army friends. Lastly here, it would be to Lieutenant Colonel retired Lauren Peppard for asking me to take the baton from him, and to Lieutenant Colonel retired Leslie Alford for saying she would take the baton from me. I can't thank you enough for the honor to be here and to pass that along to Leslie. Next slide, please. My flight lead, again. You all know who this is. So Janet said some nice things about me, but the most important recognition goes to Janet Nichols. She's the heart and soul of the Military Relations Committee and the Little Apple Brigade. All the heavy lifting behind the scenes is Janet. She does this with tremendous grace, dedication, and heart. She stood up the Kansas Military Alliance, brought national recognition for Manhattan from the Association of Defense Communities as a great American defense community. Excuse me, getting a little dry. Greeted countless new soldiers and their families as our Manhattan liaison to Fort Riley. Built a lasting trust with the entire Fort Riley community and division, and due to her incredible leadership, the Manhattan Military Relations Committee was nominated for the Fisher Award. We've been sounding boards for one another, sweated events, cajoled, discussed, cussed a bit too, to make the MRC and Little Apple Brigade the very best representatives to Fort Riley and the division. I always remind Janet that failure has never been an option, and she makes it all look too easy. There should be a standing ovation if we were live today, but for my friend, COVID makes that difficult. So please, when you see or have an opportunity to communicate with Janet, please show her your appreciation. I always say at our lunches that Janet makes me look good, so now it's time for me to return the favor. So with a real quick special thank you to Phyllis Fitzgerald, who is also one of my personal heroes, and was my counterpart for 3 of the 4 years on the MRC. I have a special presentation for Janet that was made by Phyllis, and it was part of the Society for the 1st Infantry Division. So I have a quilt. See if I do this right. Hopefully you can all see this. I have a quilt for Janet.
Oh, wow.
That was freshly made by Phyllis, and I can't thank her enough for that.
Thank you. Thank you very much, and thank you, Phyllis. Golly.
So, okay, I'm going to do this. All right, oops, next slide. Okay. So I'd be terrible if I didn't mention my girlfriend. Next click. Which is Caroline. This was taken a couple of years ago at our last brigade. But we've been on this journey together for a little over 22 years. And I don't know what more to say than she's absolutely incredible. And we support each other in our lives. With 2, you get egg rolls. So whenever you get one, you get the other one. And she's the best a guy could ask for. And love her to death. Next slide, yeah. So here's where I got a little confused. So you saw a couple of years ago pictures of the family. So here's everybody today. And you see Will, Jillian, Ellie, Rachel, Daniel, Nick, Caitlin, and James. And so, you know, I said at the beginning I would finish where I started, or I'd finish where I ended, and start where I finished. So I'll let you be the judge. Next slide, please. Mm-hmm. So click it again, yeah. So here you go. I started with Big Sis taking care of little brother, so I'll let you be the judge. But this is Ellie taking care of her little cousin Daniel a couple of months ago doing family pictures. Next slide, please. Mm-hmm. I don't think the apple fell very far from the tree. So it's been my honor and a privilege to serve our communities as the chair of the MRC. I hope the humor and fun that I tried to bring in our events has helped to bond friendships that will continue to bring our communities closer together. Next slide. Thank you, Leslie. I'm going to do this. We have a little ceremony that we're starting as of now, which would have been a couple years ago, but we have a great hat, campaign hat, and so we pass the baton or the hat to the new chair. So oops, you better show it. No, you don't have to wear it because it's not one size fits all, but it might fit.
But it's going to look good on me.
There you go, but it'll look good. So Leslie, you have the baton. So duty first, here to serve.
All right.
Thank you, Rich.
Okay, so I have here for Rich a print of the American flag. So it's called Stars and Stripes, symbol of freedom and strength, and this is our token to you for your 4 years of service. I cannot thank you enough for all you have done for the Manhattan MRC, for me personally, and for my family. I'm so glad to call you friends, and I thank you so very much. And this is just the smallest token for 4 years, so thank you. Oh gosh. So now I'm going to welcome Leslie Alford. Lieutenant Colonel retired Leslie Alford is a 24-year veteran of the United States Army. While in the Army, Leslie performed logistical and planning duties along with giving guidance on stewardship, accountability, integrity, and efficiency as a division-level Inspector General in the United States, in Europe, and in Iraq. Upon retiring from the Army with her husband, retired Chief Warrant Officer 5 and helicopter pilot Jim Hood, Leslie settled here in Manhattan, and they are the broker-owners of Destiny Real Estate. A graduate of Leadership Kansas, Leslie belongs to several local military-connected nonprofit organizations and is a volunteer with the Sunflower Casa Project. Leslie is an avid runner and photographer, and she also has 3 rather large Burmese mountain dogs named Brody, Gracie, and Abby. And if you follow her at all on Facebook, you will see her beautiful photographs of the Kansas sunrise and sunset and of her 3 rather large dogs.
Rather large.
So, and now I will go ahead and introduce Colonel Ann Kang, our guest speaker. Colonel Kang serves as a Deputy Commander for Nursing and Patient Services at Irwin Army Community Hospital. She, prior to her commission as a second lieutenant in the Army Nurse Corps through the University of Southern California ROTC program, she served as a combat medic with the California National Guard. Since her commissioning, her extensive military education includes 2 Masters of Science degrees, one in health services with an emphasis in preventative medicine, and the other in nursing to become a family nurse practitioner from the Uniformed Services University of Health Sciences, Bethesda, Maryland, and she has a doctorate of nursing practices as well. Among her many awards, Colonel Kang is also a member of the Order of Military Medical Merit and has earned the A Proficiency Designator, which is the highest level of professional achievement designator within the Army Medical Department. Without further ado, I'm going to share my screen, and Colonel Ann Kang will do her presentation. So, hold on a moment.
Good afternoon. Can you guys hear me?
Can you see this? Yeah, hold on. The screen is not sharing quite yet. Hold on.
So I'll get started. Thank you, Rick, for serving with us, and you'll always be part of our family at Fort Riley. So it's been an honor to have you here and to meet you, and you'll always be part of our team. So thank you, Rich, for everything. So I'll get started while we're getting the slides up here uploaded. I know that I see a lot of familiar faces out there, so it's great seeing you guys. I know that many of you guys are also use IAC as a medical facility for your primary care, and I see a lot of the community partners out there. So it's great opportunity today to share what we're doing here at IAC. So we have a lot of things to share. First, I know that we have moved into our new facility. So our new facility has 500,000 square footage. And so that is 3 football fields larger than our old legacy facility. So we're excited to have this new facility, state-of-the-art facility that we have here. But we are also going to be getting a new electronic health record system. And so I want to share that exciting news with the group today. So John's going to get the information up. So some of the numbers as far as our total numbers of patients that we see, we have 35,000 patients enrolled.
Wow.
So we have 35,000 patients enrolled, which includes all 47 inpatient beds. So we have our medical surgical ward, we have inpatient behavioral health ward, as well as our labor and delivery wards. We have a very busy labor and delivery ward. We deliver sometimes the busy months are up to 150 babies per month. So it's really busy depending on, you know, the deployment cycle and all that. So we could get very busy on the L&D with delivering babies here. So that's, and so as far as our other opportunities here, we have our staff. So our staff members, we have 1,100 staff members here. That's a lot of workforce here. That's including military and civilians. And that's 288 nursing staff. And so a lot of opportunities here as far as jobs and for the healthcare professionals, as well as our support staff, because it's not always the nurses and the doctors, but without the support staff, we can't run the hospital. And so there's definitely a lot of opportunities. We also have the SRU. So we have the Soldier Recovery Unit. It used to be called WTU. And so the WTU SRU, we have 300 service members transitioning from active duty to their civilian transition. So our team, our transition coordinator from the SRU, works very hard to coordinate opportunities for these service members as they're transitioning out, and work with our local business partners as well as our adaptive conditioning program so that they have internship outside of the facility, so that they have internship as well as a job before they get out of the military. So that's that. So I wanted to share some exciting news that we are gonna go through transition of electronic health record at Irwin Army Community Hospital, so that everybody's aware of what's going on. It's a very busy hospital. We also have average day of 1,320 visits, outpatient visits daily. We have over 1,500 medications that we fill daily, and then up to 1,000 procedures in the lab daily. So very busy here. We're excited to share all the news that's going on with COVID mitigations that we have applied here at the hospital, as well as COVID vaccinations. I'm gonna go over all those information. Right now, the division is at warfighter, and so we've ensured that they got tested prior to warfighter, as well as the deployers getting their vaccinations before they deploy. So I'll share that information. Janet, do you have the slides that you could put up of that, Jorge? So the next.
We're working on it.
Okay, no problem. I'm gonna talk so that I know that I'm taking people's lunch time, so I don't wanna take too much time, but I wanna share some information that we have here. So our next thing I wanted to talk about was in concert with our network hospitals in the area with Via Christi, Children's Mercy, Geary Community Hospital, and Stormont Vale. We are in concert with them to ensure that we're covering all the medical necessities what are for our beneficiaries out there. Anybody that needs intensive care unit with COVID related, we are able to, oh, this just turned off here.
This is still live, keep going.
Okay, so we're able to use the ICU capabilities in those hospitals, as well as some of the specialties that we don't have, as far as cardiology specialty or certain orthopedic surgeries that we don't have the capabilities of. Our partners and our community network partners, without them, we wouldn't be able to provide all those care. So we are very, our next slide here.
She's controlling.
Okay, so we're very appreciative with all the specialty cares that are available in our network facilities. And next slide. Okay, so on the next slide there. So, and then with our COVID response, we have implemented with our COVID response starting early last year when COVID was starting. So we implemented several mitigations within the hospital to make sure that our staff are safe, our patients are getting the treatment that they need, getting the tests that they need, and the treatments that they need. And so we are still instituting our temperature checks at the front and with a single entrance point, and we have our visitation policies as well. And then we also have what's called a nursing call screening line. So when patients call and they have questions regarding COVID and they have symptoms with COVID symptoms, we have a call line. And so the nurses have the triage protocols, and we're able to get the tests completed in-house so that we could get the results to the patients as soon as possible. So for that, we're receiving up to 200 calls a day with patients calling regarding COVID questions, COVID symptoms, and we're filtering and fielding all those questions. We have very robust testing capabilities. Here we could run up to 300 tests a day in-house, so PCR testing. So that's great. And we also are aware of the variant that are out there that is the hot topic. And we also have the capability to send samples to SAMRID in Maryland to identify the variant samples on the lab. And our public health team is very busy getting the contact tracing completed. Once we identify anybody that's positive, we're working closely with Riley County and Geary County Public Health Department to ensure that all the contact tracing is completed so that we minimize any kind of additional spread. Now, we started vaccinating our COVID vaccine. I know that some of you guys out there have already received your first or even the second shot. We initiated the vaccine on the 23rd of December. We started off with our healthcare providers, emergency personnel. So Dr. Bloom here on the left, here on the lower picture, that's Dr. Bloom. He's our emergency medicine provider. And so he was the first one to receive that and did the kickoff on the vaccine operation here. We have a Moderna vaccine. And so we are going by our DoD prioritization schema. So we have our prioritization layout on who is priority and who's our second priority. So we're down to our priority. We've also offered the vaccine to our 75 and over as well, and our deployers, of course, and then all the hospital and emergency staff. And so that's the pictures there that you see with our refrigeration and Moderna, and then our pharmacy tech drawing the medication, the vaccine. Okay. Our next slide. So this is our DoD. This is our DoD tier that is broken down, which is also it's different from the Kansas breakdown on the priorities. And so what you'll find is that we have the 75 and older on phase 1 Bravo, whereas the Kansas has the 65 and older on there. So slightly different. Our main focus is to make sure that our service members who are deploying, as well as our higher risk population with the age and medical condition and frontline essential personnel are able to get the vaccine. So we have vaccinated just under 5,000 vaccine of the Moderna since we have started. So as we receive more vaccinations, we're gonna push out the information and so that we could go down to further down the road. And so this is phase 1, Alpha, Bravo, and Charlie, but then our healthy population is phase 2. So right after C, Charlie, we're gonna offer to that phase 2. So we're in 1 Bravo, we should be in 1 Charlie here shortly after we get resupply, and then we will announce all that information. And we're pushing out the information through our PAO, through our radio stations, news network, and our public messaging. And the reason that I received my first and the second vaccine so far, the reason I received it was with our safe, the efficacy that's been put out there, and the risk of actually having the COVID disease and the risk of having symptoms from that is much worse than the mild side effects from the vaccine. So I wanted to protect my family, my coworkers, and that's why I received the vaccine. It is not mandatory for DOD, but as far as the, it is for healthcare workers especially, it is very encouraged, but it is not mandatory right now, as you guys are aware. So, and the side effect was very mild. It was arm soreness, just mild arm soreness for me. Even with the second one, it was mild soreness. Second one is definitely a little bit more sore than the first one. The arm is a little bit more sore, but it didn't put me completely out. But many people felt a little bit more sore after this with the second one. But that only lasts a day or two. It definitely is not a, it does not last more than a day or two of that soreness there. So next slide. We're going to go down 2 more slides there. So I'm going to share the information on our new electronic health record. I'm very excited to share. And so we have, many of you guys have already served in the Army or at least familiar with some of the processes of the medical record, those paper records that we used to have, where you have to carry that record from one duty station to the next duty station and hope that it makes it there, hope that you don't lose that medical record when you retire, that everything is in there. That is very sensitive topic, because when people transition from the Army, it's very important that all the medical information is located in one place. And so we've evolved from going different medical record systems out there, but right now we have what's called ALTA, Electronic Health Record, and we have CHCS, and what we have is Inpatient Essentris. So all those things, unfortunately, they don't all talk to each other. And so what we have is outpatient records, inpatient records, and dental records, as well as records from the VA. VA is going to be able to see our records as well. And we're going to have the civilian facilities to be able to view our records. So that's huge. So that's a huge thing where civilian facilities could see our records and we could see theirs. So for example, if I went on vacation to Florida and I was stationed here in Kansas, and I got sick, or my family member got sick, and we went to urgent care clinic. Now the urgent care clinic does not have our record, or my record at least, and if I had an extensive medical history, it would be really annoying or like hard for that provider to know what's going on with you, or maybe if I was hit in a car accident, can't even reply back to the doctor and they don't know what's wrong with me or what happened, but they would be able to see this by Joint Health Information Exchange. And so this is a cloud. It's a big cloud of information, just like a big cloud of information, that they could be pulling that information in, so they don't have to ask you, or they should ask you, but if you're not able to reply, then they could look it up and see what medications you're on, what allergies you have, so they could render the care that they need. And when I get back to Fort Riley, my doctor could see what was done in Orlando. So this is huge, huge initiative. It's a DOD initiative that has been launched. Certain medical facilities have already switched over. For example, like Fort Lewis Madigan, the Madigan Medical Center, they already switched over to this new system called MHS Genesis, as well as Travis Air Force Base. And that right now, currently, the Naval Hospital in San Diego is in the process of switching over to this new system. And we, Fort Riley, we're gonna go live on 24th April. But I wanted to share with you what all it entails to get ready for this transition, because it entails a lot of details, a lot of things that's in addition to just switching and learning the new system. It's very detail oriented. So we need to let the community know what's going on so that everybody could be prepared, as well as the patients too. So next slide. Okay, so the patients are going to have the what's called a patient portal with this Genesis transition. So they're going to have patients portal. They're going to have complete transparency, which means they could read the notes from what the provider wrote. So they could see what they got done, what was ordered, and they could see the notes so that there's transparency. Sometimes when we have patients come, as a medical provider, I'm a family nurse practitioner, so I see patients as in the primary care clinic. So when patients come to me and they already have like exactly what they want. So for example, somebody may come and say, I'm tired, my symptoms are tired, I'm tired, I need my thyroid checked, I need my vitamin D checked, I need my anemia, my red blood cell count checked. They already have this assumption. And so there's a lot of information out there. They could Google it, MD it, or whatever it is, but this portal is gonna have evidence-based information out there so that patients have access to that evidence-based information instead of Google MD. So it's gonna provide a lot of resource for our patients. Our next one. Okay, so the challenge that we have is this is a huge overhaul. Not many people like changes. This is a completely new system. It's not something that you could just, open up and just start charting on. And so it's a completely new system called MHS Genesis. And so we are in the process of starting our training for our staff. We are training it, and the training it's taking, there's a lot of online part as well as in-person part, and it takes weeks to train, and that's in person as well as online on their own. So this is the reason this is going to be hard, difficult up front, but at the end, it's going to be better at the end. So we're going to go through this rough patch of training, new system, completely new system. But at the end of the day, after we're done with all this, it's going to be better for our patients. This is going to be patient oriented. Our service members going to have better records as they're transitioning from active duty to civilian. So we're very excited, but it is tough. Not a lot of people like this huge change. It's not a little change, it's a huge change because it's a complete overhaul of all systems out there for electronic health record that we have. So currently we have many of our staff members in training, and you may have seen some of the information on either reduced services in lab or pharmacy this week or next week and this month. And it's all related to this transition. So I just wanted to put that out there. Our next slide. So this system also combines all the immunizations, so vaccinations. So if you receive vaccinations in one facility, like you were at the Air Force Base and you received your shot, then we'll be able to see it, and the patient could pull this information. So they don't have to go ask their provider, can you please print out my records of this shot record, because they will be able to do that from their own portal. So it's a great system. It's very patient friendly. So that's just what we want. This is exactly what we were needing. So the Health Information Exchange Cloud provides this opportunity to get all this stuff done in one place. And so exciting to hear that the Health Information Exchange Cloud also provides that information to our civilian counterparts. So when we have patients getting seen at Via Christi or Gary Community, they're going to be able to see the information, and we're going to be on the same exchange of information, which is a huge improvement than what we have currently. So no more snail mails or carrying your paper record from place to place, hoping that it makes it over here, getting lost. And then when our folks transition from active duty to military or to civilian, retired, and hoping that the VA has their information. Currently, all those are not we're not capable of doing that, seeing that. We have very limited visibility of the VA hospital to us, limited visibility on the medical care performed there too, and because we're on two different systems. So it would be, this is a huge improvement that's going to be beneficial for our patients. So we're so excited on that. The next slide. Okay. I do want to take any questions out there. I know that there might be some questions on vaccines as well as our COVID operations. So I do want to take any of those questions. I also have our SRU WTU command here. I know that there are a lot of community partners out there interested in what we're doing for soldiers, warriors in transition, and what opportunities we have for that transition population.
So we do have a question, Colonel Kang, about if you have the Corona hotline phone number, and it says, who do you contact if you'd like to get an appointment? And I was wondering, I'm going to add to that. If, let's say, I know you guys are on 1B, when do you foresee, and I know I have heard that you don't know, you're not really exactly sure how many and when you get those vaccines delivered, but do you have a vague time frame for that?
We are hoping and crossing up. I mean, it's controlled by, it's above our local level, at least, of controlling the resupply of vaccines. But everybody that needs to know to get resupply is aware on the resupply that we need for our people that need our second dose, as well as we would like to go down to our phase 2 as soon as possible, especially the folks that have high risk medical conditions. We have lists of all those that need the vaccines that are at risk with high risk medical conditions. So we have by name list of with the patients with that, and as well as our 65 and over. We want to offer the vaccine to all the 65 and over that are impaneled or have benefits with TRICARE. So that's definitely, I am hoping that we could get it resupply next week, but we are, until it actually hits on ground with our tracking number, we don't have that visibility.
Okay, so I was wondering if, let's say you're under 65, is there can you submit your name in for a list for that, or?
Phase 2, so under 65 is our phase 2 healthy population, unless they have health condition, high risk condition, that's considered a higher priority, but that's going to be, so you don't have to call or put a list out. It's going to be put out through our public messaging with our PAO. Once we get additional doses, we're going to put out the message saying we have this, and we'll probably, at that time, we'll probably do walk-in hours. We had a short walk-in hour time for 75 and over last week, which was very successful. And we probably offer that for the phase 2 so that we could, and it's very important to, we were doing appointments for our vaccinations. And the reason for the appointment was because this vaccine is very different than flu vaccine. And so just the logistical care that it needs prior to giving the vaccine, it has to be stored in a certain temperature, and also it has to be thawed out for a certain number of hours. And once it's thawed out, you have a certain number of hours to give this vaccine, and it has to be once it's drawn up and punctured, that vial, and that vial is only good for a certain number of hours. So we don't want to waste any doses. So we're systematically really making sure that we have enough people for the vial. Otherwise, we don't want to waste any doses. So it's a lot more convoluted than just the regular flu vaccine because of the logistical and the time frame and the temperature maintenance that's required of this. I do have a phone number if you want to write this down. As far as the COVID nurse line, I do have that phone number, or COVID vaccine line. we have the, it's 785-239 DOCS, DOCS, and there is a menu of options. One of the option will be for the COVID screening line, and one of the other option will be COVID vaccine line. Right now, we're taking that vaccine line for 75 and over, but right now, until we get resupply, we can't open it up basically on that. Colonel Royal was one of the briefings for operational warp speed. And so from what the information that they shared was that we are going to have enough vaccines for a healthy population by April. I mean, I'm not saying we're going to have to wait till April here, but by April, the whole nation, we should have enough to vaccinate all the healthy population for the nation. And so that's the message that he received. So how many of you guys had your first vaccine? I see you guys.
Is there a list somewhere of the pre-existing conditions that would qualify you? Okay.
So that is shared on the CDC website as well, the high-risk conditions. And most of that is cardiovascular conditions, diabetes was on there, any immunocompromised conditions are on there. So, and then if you have questions, for example, pregnant or breastfeeding or certain medical conditions with cancer or HIV, if you have particular questions, I would advise them to speak with their primary care provider, or OB provider. So we have questions from pregnant patients, breastfeeding, trying to get pregnant, or certain medical conditions like, if they were breast cancer survivor or those things, we need to have them speak with their provider and see what they recommend, because that provider knows their health condition better than the person that's sitting in the vaccine clamshell. We're doing the vaccine in the clamshell. It's by the SRU. It's the temporary structure that's between the old or legacy hospital and the new hospital. That's where the vaccine operation is for Fort Riley.
Thank you. We do have a question from Terry Sutton. She asked if IAC sees patients that are in the VA system.
We have the, so if they're already in the VA system, so they're already either retired or out of the military, and they don't have the TRICARE benefits here, then we do not see them. Now, there are certain circumstances, like if they're a retiree, we do have ability to take care of those retirees if they're enrolled here. So, and then we also offer, preventive things like the vaccines and those things. And then also we offer medication services, pharmacy services, as well as lab services for all retirees.
Thank you. I also this is also a VA related question. Do you know if the VA record system through MHS Genesis, do you have any idea of the timeline for that? And that's from Dan Watkins. He's our local VFW commander.
Yeah, so once we go to Genesis, which is April 24th, that's when we go live. And, with anything with these big changes, of course, there's a little bit of bumpy road, but it's going to be the optimal at the end of all this. It's going to be, we're going to be able to see the information from the VA medical care, the VA hospital, and they're going to see ours as well. And so that's going to be through Joint Legacy Viewer. And so we have that capability with Genesis, MHS Genesis.
Wow, okay. So there's a question from Rod Atkinson, and he asks is behavioral health transitioning to this new medical system as well?
They are transitioning now. As far as patients being able to do their own behavioral health, that will be limited because it is a sensitive, information. And so that will be a little bit different than regular visits. So yes, behavioral health is transitioning to this system as well. The whole medical system, so we are also at the same timeline as Fort Carson and Fort Leavenworth and Fort Leavenwood. And so right now, that's where all those medical treatment facilities are going to all transition to this system. And the western side, so like the Fort Lewis and Fort Irwin and Travis Air Force Base and San Diego, they've transitioned. San Diego's in transition right now, but the other MTF have transitioned. And so they're going from West Coast to East Coast. East Coast has not transferred yet, and they're going to be, and everything should be done in by 2025 for all the MTS in the entire DOD.
Wow. And then Ron had a follow-on question as well, and he was asking about confidentiality of information if patients are allowed to read provider notes.
Yeah, so behavioral health, that note is not going to be the same access as some of the regular outpatient primary care kind of visits. And so that will be a little bit different for behavioral health type of notes because of the sensitivity of that. Does that answer the question, Ron?
He had them written back, so, but that was our last question, unless anyone, here's the last call for a question for Colonel Kang.
So be patient with us as we transition. It's difficult for this kind of big change for any medical facilities, but I appreciate you guys being patient and understanding. And for our community partner hospitals and network hospitals, Via Christi and our Stormont Vale and Geary Community Hospital, being patient with and understanding with what the transition that we're going through, because without our community partners, we wouldn't be able to take care of our patients. Yeah. And if you have any questions on our warrior transition team and then our SRU, I do have our SRU commander here. If you have questions on our transition team for our warriors transitioning, are there any questions on that?
I don't see anything. Ron Atkinson did say thank you for answering the questions about behavioral health. And along that line, I don't see any other questions right now. I want to thank you for your patience. My computer screen froze with your presentation, the front page of it, and I could not get it to share. So thank you. I appreciate that very much. And before we finish up for today, would you please pick a number between 1 and 77?
Oh, I'll pick 62.
I'd have to, let me see.
Oh, that's not me.
Okay. So that is for the Briggs drawing for today. Thank you, Briggs, once again. Number 62 is Melody Sexton. Hello, Melody. I will get in contact with you and with Dick Young so we can go ahead and get you the wonderful, it's right here, taser, and there's a little sport fan as well, so you can cool yourself at an athletic event when it gets hot out. And our next MRC lunch is Wednesday, March 3rd. It'll be virtual or in person. That'll be announced 2 weeks before the event when the first invite goes out. I will go ahead and let you know. Then we did the drawing already. I don't see any more questions. We did go a little over today, so I do appreciate your patience. I will go ahead, everyone who's here, I will send the vaccine line information out to everyone who's on this meeting, the way I sent out the Zoom information. I want to thank everyone for coming on board. I want to once again thank my good friend Rich Jankovich for all his time and effort on behalf of the Manhattan Military Relations Committee and also on behalf of Fort Riley and the 1st Infantry Division. He has been a great support to all of us. And I'm welcoming Leslie. I know we're going to have a great time in the coming years. And everybody have a great day. Enjoy the rest of your week. Thank you so much for coming today.